And this is like one of the most controversial things.
I actually feel like I look more like myself.
And the easiest way to see if you like buccal fat is basically if you slightly suck in your cheek. So we did buccal fat like, I think it was like 2 years, right?
Yeah, 2 years ago.
Okay, so I'm going to talk about like the myths and like so there's a lot of things going on buccal fat, and this is like one of the most controversial things. There's like some controversial topics out there, like politics is controversial. Even more controversial, I'd say, is buccal fat.
Yes, I would agree.
Is buccal fat going to make you look weird?
Do I look weird? I'd say no. It's actually one of like the best decisions that I've made, so I'm very happy with my results.
My experience in seeing people is that they kind of look like themselves, but just like a little slimmer through here. It's not super dramatic. It's subtle, but in a good way.
I actually feel like I look more like myself because when I would do my makeup, I would try so hard to like chisel through here because I had so much fullness. But now I feel like when I wear makeup, it actually complements my buccal fat removal very well.
The next myth is if you do buccal fat, you're going to look really old and you are going to regret it for the rest of your life.
Okay. Well, I'm going on 32 and I get told I look like a solid 25. So again, I don't think that's true. Again, I feel like it complements my facial features very well. So
yeah, and I think it's, if you look at what happens to buccal fat as we get older, it doesn't really serve like a ginormous aesthetic purpose, because as we get older, it goes from the central cheek down to the lower part of the cheek. It's just like a slightly enhanced version of herself, which is what buccal fat is. Okay, so another myth about buccal fat is that like you're not going to like function the same way after. Like if you're chewing food, like you might not have saliva coming out, you might not be able to smile and move your face. Like weird stuff is going to happen to you afterwards, not just like looking weird, but you're going to function differently.
I wouldn't say that that's been the case for me. Everything feels exactly the same. When I had my buccal fat versus now, like I wouldn't say anything changed. It doesn't change the way I talk, the way I smile. I still have my dimples. I know like people say that sometimes you won't have your dimples after, but I very much still have mine. So no issues on that front.
Yeah, and so again, the theory on buccal fat is it helps you smile. It's like this little fat pad that slides back and forth. I have not seen that to be the case, because if you take out buccal fat and put it in, it doesn't really do that. The theory is that there's so many important structures, which there are, so you have to be careful because those can definitely be injured. But I've not gone, that's wood over there, if it's off camera. It's never been an issue in any of my patients. I've never had a nerve injury, never had salivary issues, never had someone smile, look weird. And so those are all really important considerations. Another question is, if you do buccal fat, you don't have a scar on the outside, but this scar in the inside of your mouth is going to be permanent. And you'll feel it, and like your dentist and other people are going to look inside your mouth and they're going to know you did something.
I mean, I've been to the dentist. I haven't had that remark made to me. I can't feel anything like with my tongue on the inner parts of my mouth. Like I don't even know where the incision is.
And that's kind of an important point because if you do buccal fat, not being able to see or feel anything, if you make an incision small enough inside the mouth, it basically heals scarless. So it's kind of nice. It's one of those secret procedures we do where there's really no way for anyone to tell if you've done it or not. Another myth is rather than doing buccal fat, you should just like lipo your face. And the answer to that is please do not lipo your face, because you definitely will look really weird if you try to liposuction your entire face. It's a really bad idea. It's very challenging, and sometimes you can get like little divots and dents and stuff like that on your face. So buccal fat removal, it's like a distinct fat pad that when it comes out, like it actually improves all of that. But when you try to lipo the face, at least especially the upper part of the face, it's usually not recommended for 99% of people out there. Another myth is buccal fat's trendy. Like so in like 10 years or 20 years, you're going to regret that you did this trendy thing.
I would say that the changes are subtle yet impactful. So in my opinion, I wouldn't say that it's something that's trending. The heaviness that I was having here, it was going down like into my lower face, and just based on like family history and kind of seeing like what's happening with them, I don't think that having, these snatched cheekbones and buccal fat removal is going to go out of trend. So,
and you're actually, I think if you kind of study like ancient statues and what's been like classically considered beautiful, that little shadow, so having your cheekbone be the most prominent, and we'll look at Christa. sorry, I won't get too close, Christa, but
Okay.
if you look at Christa, you can see like her cheekbone, and then it goes in and creates this shadow. And when you see that shadow, that's classically a sign of beauty. You can see it on both sides. Sometimes they'll give that a term called OG. So it's not like a gangster term or anything like OG, but OG is actually spelled OGEE, and it's a type of curve. And when you see that curve through there, that's kind of what you're trying to create with buccal fat. And in some patients, you just can't get rid of that fullness, no matter how much weight they lose and all that aspect of it. It's not a weight thing; it's just their anatomy. And the other point you mentioned is like you're seeing it in your family members. If you let buccal fat sit in there too long, as you get older, you get this fullness. Well, if you try to remove it, sometimes then it doesn't really balance because then the skin has been altered like such a long time.
Yep.
So I like the fact that if you're going to do buccal fat, you do it in conjunction, like earlier, or do it in conjunction with the lift, and that makes sense. Doing this procedure is going to be a super painful recovery because it's surgery. All surgeries hurt.
So I did my procedure awake just with a local injection, which that didn't even hurt. I don't think I flinched at all during my procedure. It was essentially painless. And even the recovery afterwards, like I probably had a little bit of swelling, but I mean, I went back to work right away immediately. I came back to work the next day. I was still able to talk. So I didn't experience any pain with mine. It was a very smooth recovery.
And the vast majority of my patients have a similar experience to Christa, where they're like going back to work. I even had one patient who went out clubbing that same night. Please don't do that. He was fine. Yeah, so myths about buccal fat. There's a lot out there, and it can be kind of scary if you're looking at this, but the alternatives to doing things like injecting 𝔹𝕦𝕔𝕔𝕒𝕝 in here or trying to lipo this, yeah, don't do that. That's a bad idea. And the easiest way to see if you like buccal fat is basically if you slightly suck in your cheek, just a little bit, and then you create that contour, that OG, which, again, my cheekbones are not like Christa's. So then that can create that change that you're looking for.